So psoriasis affects up to 11, 12%, if not more, of adults, about 1.5% of children, two peaks between 30 and 40 and 50 and 70. Certainly, there are a lot of different sequelae associated with psoriasis, concern, depression, embarrassment, feeling of unattractiveness, and itchiness, significant morbidity just in terms of having the disease itself. Again, same idea. What do we want? We want safety, efficacy, and tolerability in our treatments for psoriasis. Pathogenesis of psoriasis is fairly well known at this time. Activation of T cells, pro-inflammatory cytokines, causing inflammation, increased proliferation of keratinocytes, getting scale from sloughing, and thickening of the plaques as well, because the cells are mature and they don't fully slough off. There's also a significant increase in blood vessels that occurs within the radial ridges and of the epidermis and the dermis. So we have a number of different treatments for psoriasis. We have topicals, we have pharmaceuticals, and we have biologics, and then certainly we have light treatment and other treatments as well. Each one has its own issue associated with treatment, and I'll spend a little time going through this. Certainly biologics have changed the way, especially we treat severe psoriasis. What we should remember is that severe psoriasis or moderate to severe psoriasis only occurs in less than 10% or so of individuals with psoriasis. It's certainly not the common majority of people with psoriasis. The majority have limited disease, although it still can be of great concern to them. Biologics work incredibly well. However, they are very, very expensive. They certainly have immunosuppression side effects. It's also incredibly difficult to get things through insurance very often. They have to show failure of other therapies, and certainly patients with infections and TB or TB tests that are positive can be excluded from treatment. Traditional light therapies include certainly ultraviolet B and PUVA, but more recently the excimer laser. The nice thing about the excimer laser is that there are CPT codes, and I'll go through those in a little while, that have to do with laser therapy in general. Practitioners, in most cases, have the excimer laser put in by company, Strata, and they pay the company based on cars per pulse used. Patients come in once, usually twice or 3 times a week, up to 12 weeks. And because it's light therapy, there's redness, blistering, itchiness, burning sensation, and you can get an increased pigmentation. The Aerolase treatment addresses the inflammation as well as affecting the larger vessels feeding the plaque. So the laser light itself at this wavelength and with the aspect of 650 millisecond pulse suppresses inflammation and decreases the blood vessels associated with these plaques. Again, very similar as we talked about before, a very unique technology allows this to be painless, have a deep penetration of 1064 without collateral damage as well because of the unique 650 microsecond technology. So how do we compare it to others? Well, for very limited disease, we often use topical steroids. They reduce inflammation and have local immunosuppression. Certainly overuse can lead to atrophy, and we often get tachyphylaxis. And this as opposed to the 650 microsecond technology, which really coagulates the blood vessels and suppresses inflammation. And it also offers really side effect free treatment. That what we see is the rapidity and how quickly this works, much faster than with eczema. And that's really what we're doing our study to document, something we've seen over the last couple of years in using this device to treat psoriasis. Here's some examples. This is just two treatments for a patient who had a long history of really psoriasis that has not responded well to topicals or other treatments. And you can see this again, African American patient, type 6 skin, dramatic effects with just the Aerolase. Where I probably see this to be the most dramatic difference because of the difficulty in treating with any other modality is palmar-plantar psoriasis. These are 15 treatments. We've had patients who have literally responded to nothing else, did not want to go on oral therapy, have had hand and foot PUVA and other things, and have responded beautifully, as you can see here, to the Aerolase treatment. And in fact, as I said, the clinical impression we have is faster clearance, better tolerated, especially for palmar-plantar disease. And the clinical study that we're in the middle of right now is comparing the eczema and the 1064 Aerolase laser within the same patients for psoriatic plaques on the trunks, limbs, on subjects with mild to moderate psoriasis. In my medical record, I document clearly, and this is an example of a summary of the medical record, which talks about the consultation and psoriasis, what it is, what I've explained to the patients, the etiologies, and of course, all the different treatment options, which are listed here: topical corticosteroids, calcipotriene, anthraquinone retinoids, phototherapy, systemic therapies, and laser therapies. And they're all discussed. When I use the Aerolase laser, this is exactly how I document it. Regarding treatment of psoriasis, that treatment options were all discussed. And Aerolase LightPod was discussed extensively. The Aerolase is 1064 short pulse laser, and it is FDA approved for the treatment of psoriasis. Let's make that clear. It is FDA approved. A series of treatment is required to obtain optimal results. Side effects are generally minimal, but can be burning of the skin, hyper and hypopigmentation, which really we haven't seen, but I always put that in there. Eye damage and protection of eye coverings is worn, and we give patients goggles. They can expect a gradual improvement. So this is really how we document it in the chart as well. Now, again, the big question here is, how do you charge for it? Well, the CPT codes essentially say laser treatment for inflammatory skin disease, psoriasis. That's exactly what it says. It doesn't say anything about eczema or anything else. It just says laser treatment for inflammatory skin disease, total area less than 250, between 250 and 500, and over 500. And this is out of the 2018 CPT book. The Miami Medicare allowable is 174.70 for a small area, 191 for 250 to 500, and greater than 500 is $261.33 per treatment. So when you think of this, in most patients who have 5 to 10 treatments, it certainly is significant. The ICD-10 code for psoriasis is L40.0. Overall, the idea of psoriasis and acne therapy with 650 microsecond Aerolase technology is quicker clearance, better patient experience and outcomes, good financial returns, happier patients, and significant safety. And I think that's really the key aspect here.
One thing I've noticed from a clinical standpoint on the psoriasis patients is that you want to do multiple passes. You know, we tend to say for acne that we stick to 3 full passes on the face, but for psoriasis, I go by the patient's feedback, especially with these patients that have the thick plaques. I do multiple passes and I wait for their verbal feedback on like, okay, now I'm feeling a good amount of heat, and I may move on to another plaque at that point. But very often, we tend to be a little more aggressive with these thicker plaques, and you want to do multiple passes, and they're going to get their clearance even quicker by just letting them decide when, okay, that's enough heat for me. So that's a nice pearl, just to have the patient give you feedback when it comes to a psoriatic plaque.